The PUCCINI Study, a formal discussion. Welcome to our in-depth discussion, where today we focus on the PUCCINI Study, a landmark piece of research that has significant implications for patients with inflammatory bowel diseases, including Crohn's disease and ulcerative colitis, who are facing surgery. Setting the scene, the clinical question. For many years, there has been ongoing debate among surgeons and gastroenterologists about whether medications known as tumor necrosis factor inhibitors, such as infliximab and adalimumab, could increase the risk of complications after surgery in patients with inflammatory bowel disease. These medications are effective and widely used, but concerns have lingered regarding their potential impact on healing and infection rates following surgery. The primary question that the PUCCINI study aimed to answer was, does receiving tumor necrosis factor inhibitors within the 12 weeks before surgery lead to a higher risk of major infectious complications after the operation? Study design and methodology. The PUCCINI study was designed as a prospective cohort study. In practical terms, this means researchers identified patients before their surgery and followed them over time to observe who developed significant complications post-operatively. The study included 947 patients with inflammatory bowel disease from 17 medical centers across the United States and the Netherlands. All these patients underwent intra-abdominal surgery, such as bowel resections. Participants were divided into two groups. The first group consisted of patients who received tumor necrosis factor inhibitors within the 12 weeks leading up to their surgery. The second group included those who did not receive these medications or were managed with other treatments, such as corticosteroids or immunomodulators. The primary outcome measured was the rate of major infectious complications within 30 days after surgery. These complications included organ space infections, wound infections, and pneumonia. Key findings and results. After carefully accounting for other important factors that are known to influence surgical risk, such as the use of corticosteroids, the severity of the disease, and the nutritional status of the patient, the researchers found that there was no statistically significant link between preoperative exposure to tumor necrosis factor inhibitors and the likelihood of major infectious complications after surgery. In fact, the study identified that other factors played a much more prominent role in predicting post-operative problems. Specifically, the use of corticosteroids before surgery and having low albumin levels, which is an indicator of poor nutrition and more severe disease, were found to be much stronger predictors of complications following surgery. Conclusion and clinical impact. The most important conclusion from the PUCCINI study is that the use of tumor necrosis factor inhibitors alone should not be the primary reason to delay necessary surgery for patients with inflammatory bowel disease. Instead, surgical decisions should be based primarily on the patient's overall clinical condition, particularly focusing on their nutritional status and whether or not they are using corticosteroids. This large and carefully conducted study offered strong evidence to reassure both clinicians and patients that continuing tumor necrosis factor inhibitor therapy in the period leading up to surgery is generally safe. As a result, the focus of perioperative risk assessment has shifted away from biologic medications and toward modifiable factors such as nutrition and corticosteroid use. Summary and takeaway. In summary, the PUCCINI study provided crucial data that addressed long-standing concerns about the safety of biologic medications in the surgical setting. It has contributed to improved perioperative management strategies for patients with inflammatory bowel disease, emphasizing the importance of optimizing nutrition and minimizing corticosteroid use, rather than discontinuing necessary biologic treatments before surgery. Thank you for joining us for this comprehensive look at the PUCCINI study and its impact on surgical care for patients with inflammatory bowel disease. If you enjoy the content, please like, share and subscribe. It's the Everything Surgery Podcast. Dissect the extraordinary.